the factors that are largely contributing to high disease burden, TB disease burden in Mulanje are HIV prevalence rate is one of the highest in the country. For Mulanje alone, we are somewhere around 17%. That's the prevalence rate of HIV, and we feel that's too high. But also the nutrition indicators, nutrition factors, if you compare those of Mulanje against the other districts, are also not as good, and they feel they're putting a bearing again on the TB increase.
Development aid from People to People in Malawi, a member of the Humana People to People Federation, is implementing a TB-HIV program in cooperation with TB Alert, funded by DFID. The project started its field activities in April 2014 and covers a population of 500,000 people in Mulanje district.
We want to empower the community at large to know the impact of TB and to take a stand when they feel they have symptoms pertaining to TB. So we started this project in 2014, and it is for a period of 3 years. We have community health workers, 30 of them in the district that are deployed across the district of Mulanje. Their main task as community health workers is to mobilize the community so that the community at large should be aware of the signs and the symptoms of TB. And when they notice that there are some symptoms pertaining to TB, where to go and get treatment.
The overall objective of the project is to reduce new TB infections in order to further mitigate the burden and impact of TB and HIV co-infection. Tuberculosis is a major public health problem in Malawi. In 2013, 20,335 new and relapse cases and 1,400 deaths were reported in Malawi. The World Health Organization estimates that only 78% of TB cases are diagnosed in Malawi. 6 in 10 people with TB are also infected with HIV. The number of TB cases in Malawi increased steadily from 1995 to 2003, when it reached its peak, 28,000 cases. Since 2003, there has been a downward trend to just over 20,000 cases recorded in 2013. This promising news is largely due to the efforts of the National TB Control Program and its partners, although the figures are still too high for Malawi. The hardest hit districts are Mulanje and Cholo. The number of undetected TB cases is very high, and the co-infection of HIV and TB is very high as well. Let's hear more.
The problem with this co-infection is that when somebody has got TB and then he also happens to have HIV, even though we might be treating, both there's obviously a safe drug to cure TB. Even for such people, in case even if they are started on treatment, which is the right drug, the right course, and then they complete the whole course, should they be HIV positive and they are not yet put on ARVs, chances are that the TB infection may reoccur. So I think one of the possible dangers or opportunity that is going to occur is that the TB may resurface in a person who has both TB and the HIV, if only TB is attended to and not HIV. So what we have in the district, we have a program as guided by the Minister of Health in Malawi to say those of our people who have HIV, at the commencement of treatment should also receive counseling if up until that time they have not had any counseling and testing for HIV. And those that are having undergone that process and then they found to be HIV positive, they are also put on ARV immediately, so that they'll be, whilst they are on TB treatment, they are also on the ARV, so that we manage these two issues at the same time.
The Total Control of TB TCTB program run by DAPP has 30 field officers recruited and trained to implement the Total Control of TB in Mulanje. A total of 319,001 people, that's 85,818 males and 233,183 females, have been reached with TB information through the mass awareness campaigns and door-to-door household visits done by the 30 field officers. There is a close cooperation between DAPP and the Ministry of Health. Hence, the field officer acts as a link between the people of Mulanje district and the health centers. Again, the TB coordinator talks about what DAPP and TB Alert has done through the joint venture.
DAPP have a DAPP Total Control of Epidemic program, which they started, I think, about 1.5 years now in Mulanje. We, as a district and as the indeed TB program, have benefited so much from them. I can say that aside a few activities that these are but a few activities that we've benefited from the program, the Total Control of Epidemic by DAPP. After they deployed their healthcare workers, they were deployed across the district, across all the 23 health centers that we have in the district, and their main and I'm told the main business was the awareness, the health education and the awareness and the mobilization of the community, on bringing awareness to them about TB, so that once they are well informed, they are put in the know, they know what to do should they suspect any member of the community to have TB.
But in this case, when we came in, it's like the people are now getting the information at their household. That is totally different from the past. And now the sputum collection is done at the household level, whereas in the past it was not done in that way.
So in terms of awareness, I think we've benefited so much from them. From this program, and they have also reactivated a few of our community sputum collection centers, which were established before they came, and then they went inactive. The DAPP TC, they have reactivated such committees, and they have also established a few more, and apart from that, they have also organized the community groups on TB and HIV.
Saburi group imeneyi munga ndafuruza masana kuti tinayamba kumolera ndi anthu 10 kuchokera ku pali ya volunteer. Ndeti takumvesesa volunteer ja ndeti nakapanga tinapita ku support group kumolere uko, ndeti makakhala nawo anzathu akumolere kumweko ku support group. Njeno pang'ono nzeru za zimene mazitenga ife kumeneko zinali zoti chosankhawa, monga ife amatenda a HIV amati machosana amati chosankhawa, maza kuti pamene tinali ife oti mwina timagayiza kuti mwina ngati mmene tatenga ife matenda ndiye kuti titanchifa iya kumeneko tinatengako luso loti iya ngakhale tili ma HIV sitingafeya komano tikhala ndi moyo polingalira kuti tiyamba mankhwala tikangoyamba mankhwala ndi kuti tikhala ndi moyo wautali.
Tikakhala kugulu monga Saturday and Sunday timasankhana azimayi 10 ndiye timayenda mmuzi, timayenda khomo ndi khomo kumaunikira anzathu, timafika pamuzi kupanga kasewero kozala lero ticheza ndi khomo ili, ndiye timafika pamene kupemphera, mmozi apemphere ndiye mmozi amakhala volunteer ndithu kumaunikira anzathu kuti azimayi tikakhala oyembekezera tikayezese, komanso tikakhala abwinobwino tikuyenera tikayezese. Pano pa kuli matenda HIV and AIDS amene anthu akumwana wa ARV, komanso kuli matenda awawa a TB. TB imabwera munjira ziwiri, ina imapezeka m'mapapo, ina imapezeka m'mafupa. Ndiye TB imapezeka m'mapapo anthu amatha kupasirana. Ndiye ife azimayi tiyenera kukayezesa njira ziwiri, komanso timapangisa ukhondo, nzimayi akhale wa ukhondo, nzimayi azire nyumba ikakhala yozira azire, nzimayi azire mkichini, komanso nzimayi asake sache limene timatesera panja alike kundodo, akalika kundodo asese nyumba yake mmwamba, komanso nyumba yake ikhale ndi mazenera. Komanso china timalimbikitsa azimayi mkichini mwathu timamanga pophikira, pamene timaphikira ndiwo tisasiye zosavinikira, mbale zathu tisiye malo oyenera, nzimene timachita.
Ndimauza monga kwathu kuni mauza kuti mmene mukuona kuti tupani city mumapita kuchipatala kukayezesa. Ndiye ndichonyalitsa kwambiri imene DAPP abwera muzimathu nkomana tiyenda khomo ndi khomo zibwino kwambiri tinyalira kwambiri chifukwa amene akuchita amantha kuti azikayeza ayeza pakhompo apeza nawo ndi treatment kuti apeze moyo wawo.
A number of achievements have been registered over the first 2 years of the TC-TB program. 30 field officers were trained to carry out the implementation of the project. 1,638 volunteers, passionates, were identified, recruited and trained by the field officers. 403,839 people have been reached through door-to-door sensitization. 39,016 people were screened for TB. 4,478 sputum samples were collected and taken for diagnosis. 682 people were diagnosed with TB and are now on directly observed therapy. 682 are in trios or duos to assist the person on TB on drug adherence. A total of 26 TB support groups were established and strengthened. 7 microscopes were bought and handed over to the health centers, increasing the number of TB testing centers. 14 microscopists were given refresher training. 51 nutrition trainings were carried through. The TC-TB field officers, together with the passionates, are trained to go house to house, person to person, meeting people, where they inform and screen people for TB. After careful counseling and screening, the people with symptoms of TB have their sputum collected. The field officers or passionates then take the sputum samples to the nearest sputum collection center that they have established in the community. At this sputum collection center, we meet the field officer who then transport all the collected sputum samples in a box to the microscopy center for TB testing on her bicycle. The samples are burnt onto glass plates and then taken to be examined under a microscope. After finding the result, the staff at the microscopy center prepares a report with the results of the TB sputum test for each individual in the community. We now follow the TC-TB field officer who gets the reports and cycles back to present the results to each person that has given sputum samples. If tested TB positive, the person goes to the clinic for TB treatment. The co-infection of TB and HIV has become a concern for the government and the people of Malawi, as well as the world over. Tuberculosis remains the leading cause of deaths among people living with HIV. What is needed now is a systematic TB case finding, as many people with TB are still not found being treated and cured. We need to scale up the TCE program, which has proved to be an efficient program implemented in 12 countries, reaching out to 20 million people over the past 15 years by 10,000 well-trained TCE community health workers.